all about the physiology of vomiting or the emetic reflex. Now let us talk about the medications that are used to treat, manage, and prevent vomiting in acute and chronic situations. These medications are also known as antiemetics, basically preventing emesis. So, the first one is histamine 1 receptor antagonist. Those are also called histamine blockers or antihistaminics. For example, the first one is promethazine. This is a class of drug that blocks histamines, especially histamine 1 receptors. These drugs are used to stop allergy, but they are also helpful in nausea and vomiting, in morning sickness, and in motion sickness, as the diagram depicts. Then comes the 5-HT receptor antagonist. Remember, these drugs ends in satron. So remember, 5-HT3 antagonists are the drugs that end in satron. One among most popular drugs is ondansetron. Five HT, as I mentioned earlier in the video, is serotonin. So these are serotonin antagonists. And these drugs are used to control vomiting at chemoreceptor trigger zone. Next comes your dopamine 2 receptor antagonist that work at CTZ. This dopamine 2 receptor antagonists include variety of subclasses. It is easy to remember dopamine 2 receptor antagonists as they are also used to treat schizophrenia and psychosis. The first group is azine, that includes prochlorperazine, and chlorpromazine. These two are azenes. The second group is metoclopramide, which inhibits dopamine 2 receptor but increases the motility of your stomach. The final group is droperidol, which also inhibits dopamine 2 receptors, similar to haloperidol. These are also antipsychotic medicines. The fourth class of antiemetics include muscarinic receptor antagonists. Examples include hyoscine, hyoscine. These drugs blocks the receptors at vomiting center that inhibits the vomiting reflex. So now let's talk about the side effects. The first one is histamine 1 receptor antagonist that cause drowsiness and sedation. As side effects, then comes the serotonin receptor antagonists, which are good for patients with chemotherapy and post-surgery but has side effects like headache and GI upsets. Now comes the dopamine 2 receptor antagonists or the agents that also causes sedation and hypotension. Next comes the group of metoclopramide. The side effects include restlessness, increased prolactin level that can cause increased lactation. It also includes sedation and laziness. Droperidol also causes sedation on excessive use as side effects, and the last one, muscarinic receptor antagonists, they causes sedation and drowsiness and sometimes, less frequently, dry mouth as their side. In our Ayurvedic classics, vomiting has been described as chardi and antiemetics as chardi nigrahana gana. So, classics has mentioned Jambamra Pallava, Matu Longamla, Badara Dadima, Yava Yastika Usira Mritlaja Iti as Chardi Nigrahana Dasamanigan, which includes the first one, Jambu, for which the tender leaves of Jambu are being used. The biological source is Syzygium cumini. The second one is Amra. Tender leaves of Amra are used. The biological source is Magnifera indica. The third one is Matulunga, which is a lemon variety, citrus lemon. The fourth one is Badara, which fruit and tender leaves are used. Ziziphus jujuba. Fifth one is Dadima, whose fruits and tender leaves are being used, Punica granatum. Next comes the sixth one, Yava. The seeds of Yava are being used. The biological source is Hordeum vulgare. Seventh one is Yastica. The roots are being used. Glycyrrhiza glabra. Eighth one is Usira. The root of Usira is used. The biological source is Vetiveria zizanoides. Ninth one is Namri or the earth. The soil with rich potassium and calcium content. The 10th one is Laja. Laja, the fried paddy or the pursed paddy, have been told to be used as chutney. So these drugs are having Madhura and Amla as their rasa or the taste. They have Sitavirya. They are having Madhura Vipaka. And they are Laghu, Manda and Sthira in guna or quality. They all are Pitta Vatahara. This is Karma. So they have very potent Pitta Vatahara property. So they are acting as antacids. These drugs are soothing. These drugs have nourishing property, and hence they are used also as anti-flatulent. These 10 drugs or the dasaimanigan alone or in combination are useful in preventing nausea and vomiting, useful in headache, they are useful in motion sickness, or in cases of morning sickness also. They are very useful in gastric ulcers. The formulations containing Chadinigrahana drugs include Pancha Pallava Yoga, Matulunga Avaleha, one important drug Usirasava, Eladi Gutika, and Chandanasava. So thanks for watching this video.